As congressional negotiations continue over President Trump's one big beautiful bill, the budget plan, as that continues, two issues in particular appear to be in the thick of it. One is Medicaid. There was the expansion of Medicaid, which has cost a lot and is going to cost a lot more and could sink Medicaid for those individuals who truly need it. The other thing that has appeared this week, in fact, just yesterday, was that in the reconciliation has been the call to defund Planned Parenthood. That last count is about $700 million that it received from the federal government. Well, now we have moderates in the GOP, not Democrats, but moderate Republicans saying, I don't think we can support dialing back Medicaid. We've got to keep it like it is. Well, let's talk about that. And here to discuss this, Dr. Paul Winfree, the founder, president, and CEO of the Economic Policy Innovation Center. Paul is also the former White House Director of Budget Policy, having served during the first Trump administration. Paul, welcome to Washington Watch. Thanks for joining us.
Thanks for having me. I really appreciate it.
All right, I want you to break this down for us because, you know, we hear Medicaid, the Republicans are going to cut Medicaid, the sky's falling. What they're trying to do, as I understand it, is dial back some of the expansion of the Biden administration that actually threatens the program because it can't be funded.
That's right. First of all, nobody's talking about actually cutting the program. We're just talking about slightly slowing the growth over the next 10 years, which is necessary, as you said, to protect the vulnerable population, right? So one of the things that's happened in the last 15 years with Obamacare coming online in 2014 after being passed in 2010 is that states, for every one state dollar that they spend, they get $9 from the federal government for the able-bodied childless adult population that was in the Obamacare expansion, and they get $1.33 for the vulnerable population, so for pregnant moms and kids and the disabled. And one of the things that we've seen happen just over the last really 5 years is that all of the incentives within the healthcare system, in part because of some rules that the Biden administration promulgated, have been redirecting healthcare towards the expansion population, the able-bodied childless adults, and that's leaving the vulnerable truly unprotected.
And if I recall correctly, Paul, that during the Biden administration, it was primarily the blue states that expanded it and accepted more of this, where many of the Republicans said, no, we're not going to get hung up in this scheme because we've seen this movie before. I remember back when I was in the state legislature in Louisiana, the federal government entices you into these programs, and then at some point they cut off the federal funding, and you're left with the bill. But a 9-to-1 ratio is a pretty strong incentive for the states to expand.
That's right. And one of the things that the 10 states that haven't expanded are hearing from their hospitals and their insurers is that they're leaving all this federal money on the table and then they have to expand. But the reality is that if we keep pushing towards a larger and larger growth in government control and in government funding for healthcare, eventually it's going to set us up for single payer, which is exactly what the Democrats knew they were going to be doing when they passed Obamacare in the first place. They knew that we would ultimately get here. And so, you know, I'm hopeful that one of the things that the Republicans would consider as they move through this reconciliation, this budget bill, is adjusting for some of the inequities in the program so that we make sure that we can protect it for the truly vulnerable and that it's there for them when they need it.
So specifically, what should they do? Because we see some in those blue states saying, we don't want to touch it, don't want to dial it back. But then if the other states that haven't taken it, if they were to expand theirs as well, how are we going to pay for that?
So there are three things that they should be doing. The first thing that they should be doing is reducing the federal match for the able-bodied population down to the vulnerable level, right? so that the medical system, it stops prioritizing the able-bodied versus the truly vulnerable. The second thing that they need to do, and this is something that the Trump administration can actually help with, is that during the Biden administration, they promulgated rules that said that Medicaid can pay up to commercial rates. Well, commercial rates are often 2 or 3 times higher than Medicare rates, which means that the healthcare system now is incentivized again to treat the able-bodied population over even the Medicare population. So just saying that Medicaid can't pay more than Medicare would be a helpful thing. And it's actually a big budgetary saver. It would save about $70 billion a year if the Trump administration were to promulgate a rule that does that and Congress were to codify it. And then the third thing that they should do is reduce this game, this scam that the states play, where they tax Medicaid providers, and then they get the federal government to cover a big share of that tax, and then they pocket that money and they use it for things that have absolutely nothing to do with healthcare, like putting sprinkler systems into the in front of the California governor's mansion and things
Right.
like this. There are lots of waste, fraud, and abuse that they can go after.
Dr. Winfree, that makes so much sense. And the structure of the system is fundamentally flawed. It has to be fixed. We're out of time. Thanks for joining us. Very insightful.